Welcome back, everyone. Another great show today I'm excited about. Today we got Dr. Harry Aponte. We're going to be talking about his book, The Person of the Therapist Training Model, Mastering the Use of Self. Now, for those who are fledgling therapists, thinking about becoming a therapist, already a therapist, this is the book for you. And I think you even learn a lot about yourself, even if you're not a therapist. Dr. Harry Aponte has a private practice in Philadelphia. He also is a clinical associate professor in Drexel University's Couple and Family Therapy Department. He has publications on family therapy, which we're going to talk a little bit about later, training and supervision in therapy, working with disadvantaged families, and spirituality in training, in therapy, which actually I want to talk about a little bit too. If we get a chance, there's a lot I want to talk to Dr. Aponte about. Before we get started, if you want to support our podcast, make sure to share and subscribe. Hey, hit that like button. We truly would appreciate it. We like it. You know what I mean? Let's waste not any more time. Welcome, Dr. Aponte, to the show. Welcome, sir.
Thank you. Glad to be here.
This is really a fascinating. You got some great books. We've talked several times in the past. I always use a lot of your material in classes. Tell us a little bit about the person of the therapist, because this is kind of a heavy topic in a sense for getting a grasp on. So tell us a little bit about this.
Well, this is something that has been part of therapy forever, talking therapy anyway. There's been an awareness of the fact that it's human being is a human being in relation to another human being, and even Freud, who was not one to go deeply into what our personal issues are as therapists, other than to say, get into analysis and try to resolve it. He himself made it enough of an issue that he said everybody wants to be a therapist needs to go under psychoanalysis, and they need to do that repeatedly through the rest of their careers. So he was conscious that we as therapists all have our own personal issues, and there's always the danger that we're going to project them onto our patients or our clients. But that's over time, that's evolved into something much more creative and dynamic, especially during the systemic thinking that was represented by Virginia Satir and Murray Bowen, and people like that, who said, not only should you try to address these issues of your own and be aware of them, you should, try to resolve them. And both of them talked about, the impact that we have on our clients, given who we are. And in today's world in particular, where there's so much diversity in terms of people's lifestyles and their values, there's not the conformity that there used to be. It becomes particularly important about how we view people who are not like us in their spirituality and their lifestyle. It's not an easy match today as it might have been in earlier years, where people were more or less, had a sense of we hold in general similar values. Now that's not the case at all. So that when a therapist is engaging to work with a client, and nowadays you're going to have to really be sensitive to, where are they coming from, and how does that fit where I come from in terms of how my outlook about life, my outlook upon, what life is, what's meaningful in life. And that influences the work that we do. That influences our concept of what is dysfunctional and what is functional. And it influences, what kind of goals are appropriate for us to have when it comes to the work that we do in therapy. In the past, you might have said more or less, we have similar goals, but not today. Today, you really have to know who you're dealing with, where they're coming from, and where they want to go, and whether that fits in with where you are and where you would go if you had the same problems. So it's much more challenging today to engage with clients and engage with them in a meaningful way. And yet, I believe that if we don't engage in a meaningful way in a relationship, then people have no reason to trust us and no reason to open up to us and no reason to take risks about trying to change their lives and seek and work hard for some kind of change. Um, there has to be some basis for that, some reason, something to drive that. And we cannot take for granted today whether what we would see as our goals in therapy as that our clients will have the same idea as to what what's going to make them happy, what's going to satisfy them, what's going to make life meaningful for them. Okay, so it's really challenging. And so I've been giving a lot of thought to, when we train therapists, we have to spend much more time thinking about these very things. You can feel the tension in our society, the conflict in our society, whether it comes to race, and when it comes to values, when it comes to spirituality, to religion, things that are really quite critical. And as a therapist, you can't ignore that because it's going to be right there in the very heart of what you're trying to do as a therapist.
That brings me to a lot of questions, like it usually does. Those who follow me know. Once the guest starts talking, I have questions to start piling up. My first question is in regards to, I can't remember who said this quote. You might remember, I can't remember if it was Young or Adler. They said that we can't, the patient can't get more healthy than the therapist themselves. So it's almost crucial for the therapist to continually work on themselves. So if they're here, that the client can at least match that, but they can never really supersede that. Do you believe in that?
Absolutely not.
And it wasn't Young or Adler then.
Well, Virginia Satir said that, and some others have said that. Some very good therapists have said that. But I think there's a certain arrogance there, because because it assumes that somehow or another we're supposed to represent some ideal in terms of our functioning in life, and that's really not the reality that we're dealing with. You know, uh, you know, you have therapists like Harry Stack Sullivan who were very disturbed emotionally, but were also very effective therapists. And the reality is that all of us have our issues, and none of us ever get all our personal issues resolved in life. We're all struggling in one way or another. And in fact, I would just flip it around the other side, is that because we struggle to make life meaningful for ourselves, it makes it possible for us as therapists to empathize with what our clients are presenting. Because if we didn't know what it was to be in pain emotionally and in terms of relationships and in terms of some meaningful life, it would, if we didn't struggle with that, I think it would be a little harder for us to really, you know, understand or feel with our clients and what they're struggling with.
That's one of the things. That's a great answer. It's one of the things you really I like about your style is that you really advocate, I guess, for some kind of sense of immersion with that client. You really, as your book mentions here, mastering that use of self, and you get involved with the client. But it not only changes the client, but it seems to also change the therapist.
Well, it certainly does, and there have been plenty of people who have been aware of that as time goes along. But I just can't see how we can get into people's lives and the struggles that they have and be unconscious about our own personal struggles and what we're trying to achieve in our own lives. It's to me, when we as therapists engage clients, okay, we're I don't know how you can do the work without thinking about yourself and where you are and whether you're preaching something that you're practicing or not, you know, because to me, if we actively engage clients in our relationships, in the work that in the work that we're doing with them, okay, we're not only needing to be empathic about their struggles, but we also have to have some sense of, what's the path to healing, to dealing with these issues. And that means that we have to have some sensitivity and awareness about, do we have an idea for where am I going and what am I doing with myself, and what kind of responsibility am I taking for my own issues? Because that teaches us something about what the potential is and what it takes for a human being to change and to grow in life. It can't just come out of a book. It also has to come out of our own personal experience and convictions.
And that's the interesting thing about this profession. A lot of it you learn on the field, per se. You read the books and everything's nice and clean and fixed, and you try a technique and it works in the book, and then you sit there with your first client. The book said this was going to work, and nothing works. Let me ask you this, Dr. Aponte. I know a lot of therapists are going to be wondering, or fledgling therapists as well. Does it change depending on what the client may be experiencing? In other words, if they have personality disorders, if they have PTSD or trauma that they have to resolve, is that going to change how you use yourself in regards to that therapy session?
Yeah, well, I don't know if it's going to change, how you use yourself. Um, the challenge is when I'm sitting down with a client, if I don't have a sense of what they're really going through, and I mean a sense of, not just that they tell me some stories about what they struggle with and I make some observations, that's really not enough. I really have to get a feeling for what they're going through. I have to get a sense of, what's getting in the way of their changing, why they can't let go of whatever it is that's holding them back and that has them tied down and has them addicted. Okay. Um, so that, and then people come from, all different places in life, and their struggles are always, while they're in some ways, you can categorize patients with this diagnosis and that diagnosis. There's an essential humanity that we all share. And as a therapist, yeah, we have to know something about these various categories of pathology. But to me, if we're going to really get a connection with them and get a sense of what they're struggling with, we have to in some way be able to resonate with them. We have to in some way feel what they're feeling, so that we're not just thinking about, do I give them pill A or pill B or pill C? It's also going to be, how do I relate to this human being? What does it take for me to really understand this person? How do I get this person's trust? And can I really get a sense of what it is that they have to do in order to overcome what they're contending with? Because, their issues can be issues that we can help them with, but we're certainly not going to have any, at least I don't think we should have any pretension that we're going to help them resolve all their issues and they're going to come out of it, 100% angelic. Life is wonderful for me. That's not the real world that we're dealing with. So we have to have a real sense of where that person is, what they're capable of, and then a real sense of how to help them reach their particular goals. And that takes a certain kind of intimacy in terms of being able to have that feeling for where they are, that ability to sense it, to intuit it, and to ride with them and walk with them as they get on their journey, because there's a lot of subtlety to it. to the work that we do, the work that we should be doing, I believe, when it comes to a therapeutic relationship. Okay, this is not a mechanical kind of thing. We don't have an X-ray, to take a picture of it and then read it and then say, okay, that means that we should do A, B, or C. We are, the MRI, and we are the X-ray, and it's going to be how we connect with them and how that gets filtered through our own perspectives, that we're going to get a sense of, okay, this is what they need from me. Yes, I need to go to school. I need to learn. I need to learn some skills, learn something about pathology. All of that is necessary. It is fundamental. These are tools. Okay, but when it comes to the actual work, it's a very personal kind of encounter that we have with our clients. So people can come from the same school of therapy, but it's different with every person puts their particular approach to therapy into a very unique uh, context, which is, this is who I am. This is how I see life. This is how I relate to people. And no two people do therapy exactly the same way. It's always influenced by who we are, where we came from, what our life experience has been. And that's how we're going to relate to our clients. And we need to be that self-aware. And that's self-awareness that says, let me use what I know about myself and my experience of life, as well as what I learned from the book, if I'm going to relate to this person and relate to this person in a way that's going to make a difference in this person's life.
Oh, great stuff. Great stuff. And I know, again, folks, this is Dr. Harry Aponte. The book is called The Person of the Therapist Training Model, Mastering the Use of Self. And we're going to get into a little bit more detail about it in a minute. Dr. Aponte kind of reminds me a little bit of, just a little bit, one of my favorite psychiatrists, I think he was a psychiatrist or a medical doctor, but he was big in the world of psychology, was Milton Erickson.
Mm-hmm.
He always seemed to get in to that person's world, as you mentioned. Am I accurate about that?
Yeah. He had a gift, and there are certain things that we bring to this work that goes beyond what we read in books. And he seemed to have a gift to be able to read people very well, and to be able to instinctively know, what to say and what to suggest that would make a difference in their lives, that would have an impact in their lives. And some of this stuff, can't be taught. You either have it or you don't have it. And it's true of therapists. There are certain things that you can learn, but when it comes to having the gift to be able to read people, relate to them, and have a healthy influence on them, something about who we are personally, that we have or don't have, that's going to make a difference as to whether we're going to be effective.
Interesting. Well, I guess it leads us to the question of, how does your training work? You have a great program over there. How do you start getting these therapists learning how to use themselves, become more aware, and become more empathic towards their client?
Well, there are many different aspects to this, and there's no way we have the time here to really go into all of it. But fundamentally, what I am trying to do with students is to get them to be self-aware, and to be self-aware when they're actually sitting down with their clients. Okay, so that and that self-awareness means an awareness that says, I'm allowing myself to be vulnerable when I'm sitting here with the client, so that I can allow myself to be aware of, how is this person affecting me. Okay, how is this person's story affecting me? And how does that relate to my own life experience and to the things that I have learned from my schooling and from my training? All of that comes together. But that there's the particular thing that I emphasize is, and I start with, is I'm asking them, tell me something about what you struggle with in your own personal life. because I want them to be comfortable with that. I want them to be able to be aware of it, to be connected to it, and so that then when they're with clients, they can use it rather than you can't do something with something that you don't know about, that you're not aware of. Okay, but if you have your own life story and if you're aware of your own personal struggles, your own traumas, your own failures in life, your own struggles in life, if you're aware of that and if you can accept that this is part of being human and that the challenge in life is to be able to deal with that, okay, because you're not going to be able to make it just go away. You have to really work with it and not allow it to destroy you or destroy relationships with other people. If you're not aware of all of that, okay, when you sit down with clients, okay, you're not going to be able to pick up all that's going on with them, because you're blocking part of yourself, sensitivity and awareness of part of yourself. And by blocking that self-awareness, that also blocks you from resonating with their struggles, with what they're going through. But if you're able to be with your own struggles, your own awareness, your own challenges in life, okay, and you can accept that this is what I'm supposed to be doing. I'm supposed to be dealing with this stuff. I'm supposed to be not harming my partners, the people that I love, the people who are in my family, the people I care about. I'm not supposed to be hurting myself or hurting them. And I need to learn how to love the people that I care about in a way that they feel loved by me and I can treat them in that way. There's so many expectations that we have in life that are really critical for our lives to be fulfilling, that if we can accept that and we accept the challenges that's involved in that and be aware of it, when we sit down with our clients, that is instrumental. And so I work with students to say, you're human, you have your issues, I have my issues. Let's talk about your issues and let me help you to be aware of it and tuned into that and accept that as a part of your humanity and be able to identify what challenges you face in order to have a fruitful life, a functional life, a life that has some meaning to it. Okay, and so that's a good part of our training is that accepting that vulnerable humanity that we have. And I try to work with students in such a way that they're able to get to that place so that then when they sit down with their clients, they use that. They use their own personal experience. They use their own self-awareness to be able to read what their clients are telling them, to understand what their clients are trying to communicate, and to feel what their clients are up against when they're contending with these issues of theirs. They can't do that well with that kind of sensitivity and intuitiveness if they're not aware of that about themselves. Okay, so that's fundamental to the training that I'm doing, so that once they get on the path of that self-awareness and self-acceptance and also recognizing what their challenges are and how they're dealing with that, then we can move into training them when you're sitting down with clients. Okay, what are you experiencing? What's it like for you? Are you getting turned off by this person, bored by this person? Are you getting manipulated by this person? Are you getting into power struggles with this person? What does this tell you about the person? What does this tell you about what they're going through? Okay, and you can have a feeling for who they are. Okay, not just something that you hear or see and observe, but this is something you experience, so that the experience with them becomes informative for you. It helps you in your assessment of where they are. It helps you to get a feeling for what they're up against and a sense of what they need in order to take that next step to get out of that place that might have been self-destructive for themselves.
It's a lot to unpack there.
You're telling me? Absolutely, it is.
Yeah.
Because I'm talking about what I consider to be something that is basic and fundamental and essential for every therapist. Okay, that you yes, you need to go to school. Yes, you need to understand about pathology, psychopathology, the various models of therapy that are out there, the various schools of therapy that are out there. You need to have that that knowledge base. Okay, but when you get into a therapeutic relationship where you're putting that into work, into observing, into creating a relationship, getting trust, understanding, figuring out what they need, you need to use yourself. Okay, that's where the mastery of self comes in. The mastery of self says, I need to be self-aware, and I need to be able to be comfortable enough that I can work with my own fallibility, my own struggles, and use that as something that helps me read them, helps me relate to them, helps me intuit what they need from me, so that I'm actively using my personal self as an instrument of change in their lives.
It's fascinating stuff. And I know we've talked about it before. Well, my journey right now, going through learning about Jung and really using his theory a lot in some of the research that I'm doing, it reminds me a lot of being aware of your shadow and accepting this aspect of yourself, which a lot of us don't, are not even aware of it, as you mentioned. That's a big vital part just for humans in general, is to be able to be aware and accept that they're not perfect. I guess my other point would be, we're always in a work in progress, aren't we?
We should be.
Better said.
Because people can live life that says, I have to find a life that is a happy life. So then I look for ways to escape the pain of life. So I can do that with drugs. I can do that with sex. I can do that with power and money. There are many ways of escaping trying to escape the pains and challenges of life. And if I treat these challenges that I'm dealing with as simply something that shouldn't be there, then I'm going to be looking for things that are going to make me feel better. And that's not going to make me tuned into, what I'm struggling with and what I need to take responsibility for and what to do about it. That's going to get in the way of that. Okay, so I need to help therapists get to a place where they can say, yes, I am a work in progress, and I need to take responsibility for that work in progress, and I need to always be committed to changing and improving my life. And that self-awareness is also going to help me to become a better therapist.
Fascinating stuff, fascinating. And I know I always talk to people about being clear about ambiguous terms. And I guess what I'm thinking about is the goals that people have, being happy again, right? They'll say, I want to be happy again, but what does happy mean? How important is it to clarify these kind of ambiguous terms? Oh, he doesn't love me, I want love. What do you think about that?
Well, you're bringing together, our own natural humanity, but also you're bringing together our spirituality. A spirituality that says, this is what life is about. This is what's meaningful in life. Okay, is there anything to be gained from suffering, from hurting? Okay, some people say, well, this is just something that we have to get rid of. Others of us, as I believe, is that the challenges that we have in life that are outside of life, outside of ourselves, but also within ourselves, this is what we learn from. This is where wisdom is born in this, as we contend with this, as we look for ways of solving it and not letting it overcome us, especially when we know, hey, I have this particular, I tend to get depressed, I tend to be very shy, I tend to have a bad temper, okay, I tend to be intimidated by things that are too big for me. I tend to want to avoid having to engage the challenges of life. Well, yeah, okay, that's natural, that's human. Okay, and by mobilizing what we have in us and by accepting help from people outside, including one's sense of spirituality and what help one gets from it, okay, that gives us some perspective as to what life is about. and how to go about trying to deal with these challenges. Okay, that's where wisdom comes from. That's where, emotional strength and spiritual strength comes from. It's not from lying down and watching TV.
It isn't. It's interesting because kind of Nietzsche, I kind of one of his philosophies that I agree with is that what doesn't kill us makes us stronger. Kind of goes
Well,
along that
it
line.
gives us an opportunity to get stronger. What doesn't kill us and challenges us gives us an opportunity. Well, it's like, if you want to build muscle, you don't build muscle by sitting on the couch and watching TV. You have to work out. You have to exercise those muscles to the point that they may even hurt you. That's how muscles grow. Well, it's the same thing to me as far as I'm concerned. That's how, our emotional strength grows. That's how our spiritual strength grows, is when we contend with those challenges and we engage them. Okay, not when we try to run away from them, deny them, and not really look at them in the face and see them as opportunities. This is something that gives me a chance to work at it, to get help with it, so that I can then begin to become the person I want to be by contending and wrestling with this thing in a way that's productive.
Well said. Spirituality, as we get ready towards the few last minutes we have, spirituality, that's something that the world of psychology has contended with for years past, didn't include it into a lot of its therapy, didn't want to. They didn't think it was important in one aspect. They've argued about it over the years. Jung found it important. Freud didn't. And then it kind of evolved. And now we kind of see it coming back over the last decade or two, where spirituality plays a big role. And I'm not referring to religion per se, because I know those are two totally distinct concepts. But how big of a role does spirituality play in therapy?
Well, religion is part of it. That's where our spirituality gets formalized. This religion versus that religion. Okay. Everybody has a spirituality of some kind or another, in the sense of, these are my values. This is what this is what makes life meaningful for me. Okay. We all have some kind of guideline, that I shouldn't cross this line, or I have obligations towards this person or that person or my family or whatever. How do we determine, how we should be living life? Well, it's through our spirituality, and it may not be well articulated, or it may be well articulated. So, a well articulated religion has it all spelled out for us. Okay, so the Muslims have it, Judaism has it, Christianity has it, and so many other forms of religion have it formalized. Okay, but everybody has some idea of, this is good, this is bad, this is what is meaningful, and what is not meaningful, and that guides us. Okay, that helps determine how we approach life's challenges. Without that kind of spirit, without some kind of values in our own mind and perspectives about what life is about, okay, we don't know how we're going to meet those challenges, how we're going to address those challenges. So it's always there. So to me, it's important that therapists be aware of their own spirituality. Yeah, what are my values? Okay, how do what do I make of life, and what is meaningful in life for me? So that if you're aware of that about yourself, then you're going to be more tuned into that when it comes to your clients, and you'll see, what are they looking for? What do they consider happiness? Okay, what do they consider an appropriate way of, what is love? And well, people have trouble defining love, but these days, love, it can be a chaotic concept, or it can be something that's pretty well defined. Okay, but think about, how transient relationships are these days, how little commitment there is, how people have trouble with commitment these days. Let's live together and we can get in or out of the relationship, as we will. And love means, this for one person, it means that for another person. Okay, so that, I still remember what a fellow that I knew in my profession, he got married, went on his honeymoon. Uh, they got into an automobile accident. The wife was paralyzed. Well, what did he do? He divorced her right then and there. That was the end of it. Okay, for him. Well, some other guy would say, I'm not going to abandon this woman. We're married now. Okay, and we're her trip in life right now, as hard as it may be, is mine also, because this is the woman that I love. Somebody else says, hey, she's just going to be a burden to me. So then let me say goodbye and find somebody else who doesn't give me trouble. Okay, so these things are important in terms of how we look at life and how we live life. And therapists need to be aware of that in themselves, not just their emotional problems, but what are my spiritual values and my perspectives on life, because that's going to influence the way I do my therapy.
Oh, yes, I can keep you here all day, Dr. Aponte. Lots of fun conversation. I guess my last question for you is going to be, who is the target audience for this book? Is it somebody before they go into therapy, during therapy, all the above?
Well, I see this book as speaking to all therapists. I don't care what particular approach to therapy you have. I just don't see any therapist who's going to be in a relationship with clients or patients that is not self-aware. Okay, because your view of life and your view of the struggles of life is going to be influenced by your own personal experience. It's not going to just be influenced by what you read. So to me, in order to take responsibility for how you relate to clients and how you work with them and work towards what with them, okay, a good piece of that will come from your own personal experience in life, not just from the training that you get. These two things have to come together, the training with your own personal experience in life. And what I'm trying to do is to say to people, you need to be aware, and you need to take responsibility for it, and you need to be able to use your own life experience as a way to help to understand people, to relate to them, and to help them in their own journey. Okay, even though they may be very different from you, it doesn't matter whether they're very different or very alike. Okay, it's your sensitivity and self-awareness that's going to help you to be sensitive and aware of them and what they're dealing with.
Great stuff. Again, folks, the book is called The Person of the Therapist Training Model, Mastering the Use of Self. For those who are on the audio, it's Harry J. Aponte, Aponte. For those on the video, well, you can see his name below. Again, thank you so much, Dr. Aponte, for being here.
My pleasure.
Thank you, everyone, for joining us. Make sure to share and subscribe. Hey, hit that like button, as we said. We truly appreciate it. If you're on YouTube, hit that subscribe button, too. Hit that bell. Just hit a lot of things. Have a good one, everybody.